Dr. Abbas and I am a hospital and community-based pediatrician. As you may be aware, World Diabetes Day that is being held on November 14th of each year is a primary global awareness campaign focusing on the importance of diabetes. The prevalence of diabetes in children and adolescents is increasing worldwide, with profound implications on the long-term health of individuals, families, societies, and nations. The diagnosis and management of diabetes presents several unique challenges. These include management of lows and highs, treatment awareness, fear of needle, sleep issues, as well as significant mental health concerns. This year, World Diabetes Day focuses on promoting the role of nurses in prevention and management of diabetes. Therefore, we have requested Mason and his mom. Mason is a child who recently got diagnosed with type 1 diabetes, and they both are reflecting on some of these challenges as well as how the Mason's nurse Shannon effectively played a role in his management.
Tell me what it was like when you were first diagnosed with type 1 diabetes.
It was confusing.
When Mason was first diagnosed, we spent 2 days at the hospital doing diabetes training. And who helped us lots?
Shannon.
And Shannon is who?
She's a nurse.
Yeah, and what did she help us with?
She helped us with me getting all my needles done. And she also helped with, she helped you, not being worried as much.
So Shannon helped us a lot with finding out all about diabetes because we didn't know lots of information about it before Mason's diagnosis. She spent the time to really get to know our family and answer our questions about diabetes. She also spent lots of time teaching us about finger pokes, taking your blood sugar, how to count carbs, how to give you insulin, and she also helped us with giving you your first shots of insulin, which were a little bit scary. So we met with a pediatric endocrinologist. We met with a dietitian who also gave us lots of information.
Yeah.
One of the nice things that we got to spend lots of time doing with Shannon is practicing how to inject insulin. So she gave us a practice set of needles and a ball to poke into so that everyone could practice and so that we all felt comfortable with doing insulin injections by ourselves.
She encouraged us to do giving us me needles by myself, yourself.
And she wanted everyone to try and make sure they knew what it felt like as well, right?
Yeah. She also sent they sent us home salt water for it.
So that we could practice doing injections.
Yeah.
Okay, the second question is, how have the nurse educators helped alleviate some of your fears? So what were you really worried about and nervous about when you were first diagnosed?
I was really nervous about getting needles.
Had you ever had needles before?
Not really. I had a couple flu shots, but that's nowhere near where you're supposed to get these.
Did you have any other fears or worries?
I was worried how would it change our lifestyle?
Yeah, you were really worried about not being able to eat all of the things that you wanted to eat, that you were used to eating. And Shannon really helped us with knowing that it was just going to be an adjustment and anything that you did before you could still do. We just had to maybe find some alternatives for foods.
Yeah.
And for me, she really helped me and alleviate my worries about all the what ifs. What happens when Mason goes low in the middle of the night? What happens when he has his blood sugar and it's too high? And she really reassured us that the clinic at the children's hospital would be there. She always was able to follow up with any of our questions and made sure that we knew that it didn't matter what our questions were, that it was important for us to ask them and that there was no silly questions. She always gave us an answer that helped answer our questions, right?
Yeah.
So do you have any messages to people in the community about type 1 diabetes and what it's like to live with type 1 diabetes?
Like if you know somebody's diabetic and like they're eating like candy, you shouldn't like go and be like, you can't eat that, because they can't eat it, and it also might be like an emergency.
I think it's always really important to know that people with type 1 diabetes are always trying their hardest, and especially when you're new to a diagnosis, it's lots of big changes, and sometimes people make lots of assumptions about what it's like living with type 1 diabetes and the rules that go along with it. And instead of sometimes making judgments, it's important to just ask questions, because people can help you understand a little bit better when you ask questions.
Yeah.
I think the other message would be is that just because you have type 1 diabetes doesn't mean that you can't or you have to miss out on things. Sometimes it takes a little bit more planning and organization, but you get to do everything in life that everybody else gets to do, right?
Yeah.